Good afternoon. My name is Melvena Scott, and today I will be interviewing Tanya Williams. She is a nuclear medicine technologist at Memorial Hermann Hospital in Katy, Texas. Tanya, did you know early in life that you wanted to be a nuclear medicine technologist?
No, actually I didn't. When I was in high school, my actual interest was to be a veterinarian. So I've always had an interest in the medical profession. But once I've learned more about the industry, this field seemed more interesting to me.
Was there a teacher, a neighbor, family member, or a role model who influenced your decision to go into nuclear medicine?
I had a lot of good influences, but the one that's probably the most memorable is my anatomy and physiology teacher. She had a different way of teaching, so we can memorize a lot of massive concepts, and also just her energy. So she's the standout, the star.
Wonderful. Would you describe your formal education? What degrees and/or certifications that you had?
Initially, when I went to the nuclear medicine program, they had an associate's degree program because there was such a high demand for the field to get people to work into the field. So initially I started with that, and then I eventually went back and got my bachelor's degree. And then as far as my certifications, I have 2 board certifications. One is the Nuclear Medicine Technology Commission Board, which is NMTCB. And then the second one is the American Radiologic Technology Board. So I took 2 exams.
Was a communication course required during your studies?
Yes, and that was basic communications, basically like speech, and so you can know how to give presentations and things like that.
Do you, let's talk about your hours at work. What sort of hours do you work?
Like a 9 to 5, so basically, it's just daytime hours.
Well, do you have good benefits?
Yes.
On this job?
Yeah, they're decent.
What do your benefits consist of, and are they affordable?
The health insurance program is a big network of physicians. Memorial Hermann has a lot of sites, so they have a lot of physicians within the group. So we're basically covered under their plan to see the different physicians within the network, and then we also have dental and you have different degrees of which one you can select. Like if you want to do like an HMO, or if you want to do a
PPO, maybe?
Yeah. And so I'm under a PPO program where you have a lot more flexibility to see whoever you want to see. And the same with the dental program, you have a choice between an HMO or a PPO as well. And then we also have lawyer assistance if we need that for different things, whether it's
such as malpractice.
And as well as your personal.
Are you required to carry malpractice insurance?
No, not for my field.
Okay, what is most stressful about being a nuclear medicine technologist?
Probably, since I'm actually the manager of my department, just the stresses that go along with that. As far as dealing with the patients, that's a natural for me. I don't get too stressed out about patients, but the behind the scenes work to get the department to keep it running, and training staff and making sure they're following the laws of the land that we have for our industry, and just making sure we're compliant. Stresses go along with that because there's a lot of deadlines and a lot of expectations. Right.
So what do you like most about your job?
I would probably say the patients. Yeah, just because we do it. A lot of people are dealing with a lot of issues with their health, and so it really feels good at the end of the day when you make someone feel comfortable and made them feel at ease regarding getting their testing done. Because a lot of people, they come in our department, they don't really have an idea of what nuclear medicine is, and they're actually a little nervous about it. And then once they finish, they're like, "Oh, it wasn't that bad," So it actually, most of the time, I exceed their expectations. So I like that part of the job.
And what do you like least?
Probably the red tape, the behind the scenes stuff that goes on. That's, we have not only do we have to follow by the Texas state law, we also have a nuclear regulatory commission, and so there's a lot of things that we have to do that sometimes it seems a little tedious, but I know it's important, but it's just a little tedious. Yeah, those kind of things.
So what types of situation do you encounter where you have communication downsides or challenges that you have to meet?
Probably the most recent thing was when they did a change with Medicare, and they have an expectation for all imaging modalities to have a certification with they call it the what is the correct word? It's basically, it's like a certification to make sure that all the labs are doing the correct thing, and that the procedures are being followed as far as how you calibrate your cameras, how you take care of your patients, what are your doses that you're giving the patients, are your physicians that are reading the scans, are they doing a good job? So it's a lot of things that, what they did was they changed the way that they reimburse Medicare.
Right.
And so we had to get this certification. And so with doing that, it was a lot of things that we had to do to actually prepare to do that. So they gave us like a warning that it was going to come, where if you didn't have it done by 2012, I think, then you would lose your reimbursement. So that, that was a little, it was good. I mean, it was good training, but it was just, just a lot to win.
It was a challenge.
Yeah, but it was a good challenge. So,
what do you think are your communication strengths, and what do you think are your weaknesses?
My communicating strengths are keeping people calm.
Mm-hmm.
Yeah, so that's probably the biggest thing, is when I relay information, that I relay it in a calm fashion to let people know, don't panic. It's not good news, but don't panic.
Right. And what about your weaknesses?
My communication weaknesses. Wow. I'll think about that one. Let's see. Maybe because my voice has been said is too soft sometimes, like I need to talk louder. Mm-hmm. It's probably the thing that most people say, that I don't talk loud enough.
And I've been told that I talk too loud. What are the challenges of effectively communicating with patients or other healthcare professionals from a different cultural background?
First of all, every year for our we have to do this coursework every year that what is that called?
Annual training.
Yeah, it's like our annual. Yeah, it's like annual training.
Culture and sensitivity.
Yeah. So we do different things every year, and that's one of the things that we do as a reminder. Okay. And so one of the things is that it focuses on not just cultural differences, but it also focuses on age and things like that, how you communicate with people of different age brackets. So what I take from that is, and even within my department, the people that are my subordinates are from different countries. I have people within my department that are from Egypt and Kenya and American and China, and I manage those people with all those different cultures. And so that, and I know that there's different ways that people get the information by how you relate it to them. Right. So yeah, I've mastered that pretty good on that.
Well, tell me, does gender play a role in how you communicate with others?
I don't really think so. I think that it's important to be respectful toward all people, regardless of whether it's male or female. So I think that whatever you say to anyone, you want to make sure you say it in a respectful manner. Just like no different than what you would say like to your mom and dad. You wouldn't talk to your mom and dad like that. So why would you talk to anybody else like that? So.
Can you tell me, what role does nonverbal communication cues play in your work environment? How did you learn to interpret nonverbal communication cues?
Nonverbal, probably a prime example would be, there's a gentleman that was working on a department, and he gets overwhelmed and stressed very easily. And he doesn't say it, but how it comes across is the way he moves around. He's like he's rushed, and then also just sometimes even the way a person's facial expressions look.
Right.
So you just kind of have to cue in on that, and then what I would always say is just do one thing at a time and do it correctly. And that's always been my model, even when it's like a lot to do. Just focus on that one thing that's in front of you and make sure you do it correctly and get that one task done. And you know it's going to be a lot to do, but you know you got to focus so you don't make mistakes and things like that. So.
Okay. Well, do you have any final thoughts or advice to give me as I make my journey toward an organizational communications degree?
Probably the only thing is just be respectful when you communicate with others, and talk to people in a calm fashion as best you can, even when it's something that's kind of maybe not a calm thing to talk about. Try to be as calm as you can. If you have to kind of go and recite it to yourself, maybe go to a private place real quick and kind of recite how you want to project what you want to say, so that it comes across to the other person not inflammatory or not too much.
Okay.
Yeah, so that's right.
Well, I would like to thank you for taking out the time to help me to complete this project. I've learned a lot in just a few minutes that we talked. And again, I'd like to thank you.
Well, thank you.
All right. What's our time? We have time left?
11:33, yeah.
That's cool.
Oh, that's good.